Oh, I got it. Hi, I'm Kevin Kohlbrenner, and this is my presentation on the neurobiology of addiction. So, in this presentation, I'm going to talk about um, why drugs are such a major problem in our country. I'm going to talk about how addiction affects dopamine levels in the brain, and then I'm going to talk about three different treatment options. The first is going to be medication assisted treatment, the second is behavioral therapy, and the third is 12-step programs like Narcotics Anonymous and Alcoholics Anonymous. All right. So, the U.S., as you all know, has a terrible opioid epidemic or drug epidemic. About 20 million people in our country suffer from some form of addiction. Um, about 15 million suffer from alcoholism. About 3 million suffer from opioid use disorder. The remaining 3 million suffer from things like meth addiction, gambling addiction, sex addiction, and maybe angel dust addiction, marijuana, cigarettes, things like that. In 2015, there were 50,000 overdose deaths. Um, in 2018, there were 67,000 overdose deaths, and 47,000 of those were from opioids, um, be it prescription or heroin. It is the number one cause of injury-related death. Um, Another fact: two-thirds of all opioid-related deaths are um, because of synthetic opioids like fentanyl or carfentanil, and that's excluding methadone, and that's from the cdc.gov. So dopamine. Dopamine is basically our brain's chemical equivalency to motivation. So dopamine drives survival instincts like procreation, food, and water. And addiction hijacks the areas in the brain like the nucleus accumbens and the ventral tegmental area. These are part of the limbic system, and that's why for addicts, getting drugs is paramount to all other survival needs. Um, so dopamine is measured in nanograms per deciliter. On an average day, an average human being releases about 50 nanograms per deciliter. Um, let's say on somebody's worst day ever, like you lost your job, or you got dumped, or you get evicted from your apartment, something crazy like that, um, your brain's going to release about 40 nanograms per deciliter. Let's say your best day, let's say you hit the lottery, or you win a car on some game show or something crazy like that. Picture your best day ever, and your brain's going to release about 100 nanograms per deciliter. So having sex releases about 92 nanograms per deciliter. Your favorite food, for me, chicken cutlet, releases about 94. So the age-old question, is chicken cutlet better than sex? Yes. Meth releases 11 times more dopamine than even your best day. So about 1100 nanograms per deciliter. Quite unnatural. So when opioids are used for pain, what they do is they bind to the mu opioid receptor and mimic the internal endorphins responsible for natural pain control. I was hit by a car in 2006 on Christmas Eve, hit and run, so that would be something like worst day. But I didn't feel really any pain until I got to the hospital, and my foot was getting wrapped by one of the doctors or nurses or whatever, because my body was releasing natural endorphins to combat the pain. When opioids are used not for pain, when they're just used recreationally, they disproportionately increase your dopamine by inhibiting dopamine inhibitors. So it's like a double negative equaling a positive, just like in math. If you inhibit the thing that inhibits dopamine, then you're going to have a flood of dopamine, which is why a lot of people keep taking this drug. What it does is it causes an overly rewarding sensation. from all that flood of dopamine. Now, alcohol has a 17% addiction rate. Opioids have a 17 to 25% addiction rate. So you give 100 patients prescription painkillers for their problems, and about 25 of them, 17 to 25 of them, are going to develop an addiction to that, and oftentimes that leads to things like buying their prescriptions at a higher dosage off the street, and then eventually buying like heroin off the street. So, this is Gary. Gary has been prescribed painkillers, and need I remind you that we are rating this on creativity, and I drew this. So, this area of the brain is the ventral tegmental area. That is affected, and the nucleus accumbens is also where dopamine levels are highly affected due to addiction. So, finally, we're going to get to talk solutions, treatment options. So, the first, as I stated before, is medication-assisted treatment. Now, these are 75% effective, as long as they are used in conjunction with behavioral therapy. Now, for opioids, there's methadone, there is buprenorphine, which comes in brand names like Suboxone or Subutex, and then there's naltrexone, which is an opioid antagonist or a blocker. And for alcohol, there's baclofen, there's gabapentin, since alcohol affects the GABA receptors in the brain, and there's naltrexone works for both alcohol and opioids. And these success rates are about the same as, let's say, antibiotics are for strep throat. It's about 75% effective. So these are really promising numbers. The second is behavioral health therapy, and why medication-assisted treatment is so important is because let's take an addict who gets a high tolerance to, let's say, heroin, and eventually the same amount of heroin does not give the same amount of dopamine. So you either have to take a lot more heroin to get that level, but eventually your dopamine levels are so depleted that a lot of times heroin addicts are just taking heroin to try to feel normal, and oftentimes they feel even less than normal in terms of dopamine being released. So medication-assisted treatment, what it does is it builds back up those dopamine levels so that when they do behavioral therapy or go to 12-step meetings, they're able to pay attention and to have the motivation to complete their treatment programs. Behavioral health therapy, it includes like talking to counselors, but it also, like, EMDR therapy is it targets like early childhood trauma and things like that, and really getting to the root of why people turn to drugs in the first place. And the third treatment option, as I've mentioned, is the 12 steps, either in Alcoholics Anonymous, Narcotics Anonymous, there's Gambling Anonymous, there's Sex Addicts Anonymous, there's Overeaters Anonymous. They're all the same 12 steps, and I am a firm believer in the 12 steps. I know many people who have gotten sober. I myself am sober and clean because of the 12 steps of AA and NA. And the great thing about them is that they're free. Meetings are free. The 12 steps are free. A big book costs about $7. And at any one of these meetings, there's members that are more than willing to take you through the steps and help you get to the root of your disease and your addiction, and to help give you a solution. So I am a firm believer in tackling a problem like addiction from all angles possible. So medication, going to see a counselor, a therapist, utilizing rehabs if necessary, 12-step programs, really, whatever it takes to stay alive, because it is a deadly disease, and it's rampant in our country. And I think a big part of the problem is the stigma attached to addicts, and the fact that not everybody has the facts, and not all addicts have access to the treatments available. You know, people don't judge people that have heart disease for relapsing in their treatment programs and having a steak or eating some Twinkies, or people don't, harp on diabetics for, having a cake or having a cookie. And I think it's a shame that addicts get stigmatized and discriminated against for having relapses. So I think it's important for the public to just to give more support to addicts who are trying to seek treatment, and to make it more available. I think availability is another huge thing. A lot of poverty-stricken neighborhoods are underserved in terms of treatment options and availability to treatment. And I don't think addiction is just a problem for addicts. I think it's a problem for the whole country, and that we all need to come together and educate our youth as to what addiction really is. Stop the just say no rhetoric, and stop cracking eggs in the pans, and really start educating our kids and telling them how drugs affect the brain and what the behavioral effects are and what the consequences can be. So thank you for listening to my presentation, and I hope you learned a lot.